You're listening to The Health of Business, where we talk openly and honestly about what it takes to run a healthcare clinic business in BC and Canada today. I'm Danielle Boyd, and I'm glad you're here. A quick heads up before we jump into this week's episode. The Business of Physio 101 early bird pricing may have wrapped up. However, I've got a special discount code just for Health of Business podcast listeners. The Business of Physio 101 course is for anyone who works in the private sector and wants to understand business operations, contracts, compensation models, clinic finances, and just how business decisions actually affect your career. If you visit danielleboyd.ca/courses and select Business of Physio 101 and use the code podcast10 at checkout, you'll get an extra 10% off on your order. The link is also in the show notes, and I look forward to seeing you on March 11th when classes begin. Vince, welcome to the show. I am so excited to dive into all the things new clinic ownership, PABC, and just learn a lot more about your career trajectory, values. And yeah, I'm pumped. Thanks for taking the time today.
Well, I mean, thank you for the approach. I feel honored to be sort of part of this podcast. And even though I think we've only met each other once in person, just kind of following your journey as well. And so I'm honored to be here and have this sort of one-on-one with you.
Well, thank you. Yeah, as we were just kind of preambling, it's been a wild ride, but in the end, it's really led me to meeting amazing people like yourself. So I, maybe a year ago I wouldn't have said this, but now I wouldn't change a thing.
Yeah. I feel that.
Yeah, right. Hindsight is 2020, but when you're in it, it's a little harder to see that. We're at the 50,000 foot view level now. So yeah, I mean, given that we have actually really only met in person once, I'd love to hear a little bit about like your background, your journey to becoming a physio, and now ultimately, and we'll unpack this one thoroughly, I hope, opening your new clinic in Kelowna. Congratulations, by the way.
Thank you. Yeah, it's definitely been a journey. My backstory is like it's lengthy because I've been a clinician now for almost 25 years, and so I'm from Saskatoon originally. I now am based out of Kelowna, and yeah, definitely have been a journey. I graduated in 2001 at the University of Saskatchewan with what was still a bachelor's of physical therapy back then. I did have an anatomy degree prior to that, and worked in Saskatoon for 13 years until we moved here. In a very, very quick and short time, I went through a lot of the continuing education, obtaining my IMS credentials, my FCAMT, became a manipulative CAMP therapist within a 4.5 year time span, which I don't think is doable these days. And that was all at the time where, I was just first married and we're starting to have kids. But I credit my employer at the time, because I was working in private practice in a multidisciplinary clinic, providing me with a very good, as a new grad, like educational stipend. So I was able to actually travel Canada, take courses from, at the time, the sort of the gurus of manual therapy and orthopedics, and just had a really good learning opportunity from so many known people. And then I started around that time, like 2004, started sort of my professional volunteer career, as I say, because I've been a volunteer for like over 20 years. Served in the Saskatchewan section of the orthopedic division, which turned into serving at the national orthopedic division level, becoming chair of that, serving that for 6 years, moving to Kelowna, and then serving on PABC as the Okanagan director, then president, and soon to be past president in the next year. But it's been rewarding to have all of that opportunity, and I never thought of myself to ever be in a sort of a leadership position. I'm an introvert by nature. I'm a shy person, and so I've just kind of grown into that over time, and to also have the privilege of building, I guess, a network and friendships across
Hmm.
Canada has been a really rewarding experience throughout that time.
Yeah, I have to say physios are some of the best people. Like, intelligent, kind, caring, fun, and, like, just some of the people that I mean, you've obviously just spoken to this, but some of the people that I think we've met in the community, especially over the last couple of years, I feel like the community's become more tight-knit, stronger, more connected, and yeah, there's some amazing
Yeah,
people in the community. It's really awesome.
for sure. And it was quite eye-opening, moving from a different province where
Mhm.
I literally knew 5 people in Kelowna. I didn't know any other physios. I knew maybe a couple of physios in Vancouver
Yeah,
who actually, you know, I knew from Saskatchewan,
right.
but coming into a whole new province, into a whole new medical system, a whole new practice world was very, very intimidating. And I had the opportunity over a month, because I moved here actually a month ahead of my family as we were
Mm,
still trying to sell our house. And
right.
so I took every opportunity to like network and market and get the word out that I was here in town and
Uh,
you know just sort of get the word out and put myself out there and be a
yeah,
bit vulnerable, which I'm not used to doing. And yeah, like you said, like there's a whole lot of great people
yeah,
within the community.
yeah,
And then now to be able to meet people on the board who are representing different regions of the province and knowing who they are. Yeah, it's just been very fruitful that way.
absolutely. What prompted the move to Kelowna for you and your family?
Well, I grew tired of winter. um, and so,
Touche.
yeah, there are many factors, but my wife has relatives here, and
Mm,
so we just started to visit them in the summertime. And I'm like, what is this place? Like, this is an amazing place. It's got all 4 seasons,
yeah.
and it's just kind of a smaller community that I think we wanted to end up in.
Mhm,
And there were there were other opportunities for me to pursue as well as a clinician
mm.
that I wanted to explore. And so beyond
Yeah.
that, like what's not to like about Kelowna? And if you ever get a chance to come here or visit, like you need to.
Yeah, I've actually funny story, my parents are actually in Kelowna at the moment,
Oh,
yeah, I'm visiting a family member, but, yeah, I love Kelowna. I mean, I'm in Kamloops, so I don't
right.
come to Kelowna as often as I would like to, but the Okanagan, there is just something absolutely magical about it, so
Hmm.
that's huge, and you have also now just put down even deeper roots in the community because you've opened your
Yeah.
clinic, so congratulations.
Thank you.
I would love to hear what that experience was like for you. Like, what kind of prompted that? And, like, what did that journey look like? How long did it take? Yeah, let's dive in.
Yeah. Well, mentioning off camera that I was looking at your Instagram the other day about you posting physio career paths, and yes, I've been in public practice. I've been a private practice employee. I've been a private practice contractor. I've done teaching. Um, I've done the non-clinical work as a
Yeah.
board member, and now I'm the only piece that was missing was the clinic ownership entrepreneur.
There you
So
go. You had to get the
why
bingo.
not? I had to totally, totally get the bingo. The long and short of it is, and I, since moving here in 2014, I had the privilege and the honor of working with a company for almost 11 years
Wow.
and a clinic director of their newest satellite office for 8 years.
Mhm.
And so the long and short is my succession plan that was sort of laid out and drawn out for me. It didn't work.
Mm,
So um, it just so happened that an opportunity came about, and I seized it.
amazing.
And here I am. I feel that at this stage of my career, probably best to kind of take a leap, especially if my head and heart were going in that direction
Mhm.
some time ago. And it honestly couldn't have worked out any better.
Oh, that's so
Yeah.
great. That's
Yeah.
awesome. And yeah, sometimes those opportunities present themselves and it's hard to not seize them, right? Like you
Yeah.
have to explore that, especially as someone who clearly has all these different abilities and experiences, and it's an experience that obviously you've felt drawn towards. So that's fantastic. So when did you open? It was a couple months ago, correct?
So we opened August 18th
Okay.
of this year, and it was already an existing physio practice that the previous owner was looking to head into full retirement,
Mhm.
and he basically made it fairly easy and seamless to take over, and for him to retire and like sunset himself and his wife, who was the office manager. But they had owned this practice and been operating for 30 years.
Wow.
And he had a couple of other partners as well that partnership had dissolved. And so this was the right time for him. And he clearly was trying to look for the right person.
Right.
But yeah, since August 18th, took over the practice, basically rebranded,
Yeah.
and I inherited a team of practitioners, including
Ah.
the retired owner, as well as his wife. And they're completely out of the practice now, um, holidaying in Hawaii currently, which is as they should.
Retirement, yes.
Retirement. And so in the last 3 months have still been able to retain and build a team of 5
Wow.
practitioners, including myself,
Yeah.
and then 3 clinical care associates that manage the front end.
Wow.
And that's that. It's definitely been a journey, an emotional one. And I was doing it by myself. I didn't. It's not like I had a full financial, administrative, or HR team. I leaned into family as much as
Yeah.
I could, and they've been so helpful and supportive.
Yeah.
And now it's just 3 months in, like trying to establish processes and trying to schedule myself so that I can be dialed in administratively
Mhm.
and not be like, oh, I I should remember to pay this bill today, uh, and on time. Things like that are just, thankfully, I know that those things have to be done.
Yes.
Um, but I'm, yeah, definitely quickly finding out that I do have to kind of dial in a little bit on the process side of things, because I'm still operationally quite involved. Um, and then eventually starting to look at like practitioner and client metrics and so on, so that we can work efficiently
Yeah.
and generate future planning.
Exactly, like, break
Yeah.
all that down, get the data, figure it out. Yeah, it's a lot, right? And you're also practicing clinically, so to have, like, X amount of clinical hours on top of the administration, and the administration, like, in the first 3 months, like, things are in flux, right? Like, it's changing and the data is, evolving, and so it's not like you have this easy, like, day in, day out kind of routine yet. I'm sure that that's very much still being established and you're figuring out what that looks like and what the role is and kind of eking that all out and figuring it out as it goes. So, yeah, I'd
Yeah.
imagine you're probably very much in that kind of, like, figuring it out phase.
Deep, deep into it. But I also kind of credit my leadership position and the previous owners of the clinic that I was in, because I was often involved in leadership meetings, and we would talk business things and we would talk
Mhm.
planning. So I very much credit that experience and credit them for basically mentoring me through that process,
Mm.
and to have that knowledge carrying forward to open up myself. Yeah, but still, obviously still learning and leaning into people like yourself and the association and other friends who are clinic owners in within VC and elsewhere, just like, what do you think of this? And
Yeah.
it's nice to have, once again, that network to sort of bounce ideas off of.
Oh my
other
gosh,
people.
right? Like it's invaluable to have those relationships with people and kind of just be able to bounce ideas off of each other. How are you handling this? Like, did you try that? How does this work? It really makes such a big difference having such a great community of people. How did you find, I mean, like obviously you've worked in leadership positions, you've worked on the board. Like it's not like you were brand new to leadership or to, business at all. Did you find there was any areas that, like, you really were forced to level up in, though, in this process?
Um, y- yes, and I think more in the well, maybe not now, but like through the journey of being a clinic director, managing people and always trying to be present and having eyes and ears in the clinic, even though you're not there.
Yeah.
Those are definitely the challenges, but I definitely grew in that process.
Mm.
I guess it's like right now, probably just more the operation side of things. Um, I mean, I'm now responsible for people who, you know, have a livelihood and need to feed their family. So that's for me, that's as long as I can continue to make payroll and manage that, then I know that we're rolling.
Yeah.
I'd like to be able to pay myself one day. Uh, you know, the value, my
Yeah.
value,
Yep.
my worth. But
Yes.
yeah, it's I every day is a learning experience, and I think part of this profession is always there's always going to be learning, and it's always ever evolving. And coming from an association lens, like we know that
Mhm.
because there's always people behind the scenes that are working to make the profession better and to evolve and to grow.
Yeah.
Yeah.
Yeah. And to be in a position now where you are at the helm of a clinic and of a team, like what a great position to be in to continue with that growth and then to use, like your connections and understanding and knowledge of what's happening in the profession to be able to support your team, with that level of understanding and connection and, influence to an extent too, right? Like you're really helping to shape the profession of physio in the province through that role. And so how great that you can like use that to shape the profession and the clinicians and the staff that you're working with at your home clinic, right? Like
Yeah.
it is a mutually beneficial role, I guess.
Totally. And you um I suppose you don't really become a leader without like walking toe to toe, shoulder to shoulder, standing on or getting a piggyback on the shoulders of those around you, right?
Yeah.
And you climb with them, and if they're supportive and like-minded, then they'll generally push you forward
Mhm.
to the top. But it's definitely, thankfully, not lonely up there. It's you are developing with those around you.
Yeah.
So it's nice to have the kind of a sense of that in the clinic. And even though I inherited three practitioners,
Yeah.
those who've joined me, I actually know or have worked with before,
Mhm.
and have basically sought me out. So it that's where I'm grateful
Yeah.
that I'm grateful for, right? And I just wanted to build and want to continue to build a team of people that they want to work here, they want to work with me,
Yeah.
and um, I would say that I wouldn't necessarily have someone here that I wouldn't want to work for. I want to work for all of these people if they were to be clinic
Yeah.
owners, right? And that's kind of how I see it.
Yeah, like that relationship is a value, like it's a value-based relationship. You're,
Hmm.
it's yeah, you're supporting each other and yeah, it's people that you like and respect and enjoy and want to elevate. I'm
Yes.
curious, what were some of like I mean, obviously the process of of opening a clinic is possibly different than inheriting a clinic, but what were some of the biggest I want to, kind of do a compare and contrast, like what were some of the biggest challenges for you in the process, whether like personally or like from a, like operations standpoint, like what were the biggest things that you learned, or like what were some of the biggest challenges or headaches that you faced in the process? And then I want to like flip it and find out what were some of the like pleasantly surprising, easier than expected aspects of it. Like let's start with the challenges. What were some of the bigger like mountains you had to climb in the process?
So I'm an emotional person,
Mhm.
and anyone who knows me knows that like I cry at a gum commercial.
Oh,
So uh so
me
the
too.
biggest struggle for me was making the decision to leave
Mm,
uh a practice, a community, a team who I really loved to work
mm,
with. Um and the other thing was growing a clinic over 8 years that I knew was going to end up not being mine,
yeah.
basically.
Yeah.
Um, but as in anything that I do, it's rooted in love, and that's kind of my mantra. So I knew that um, I needed to move forward and kind of separate myself. So that was for me was the biggest, I think, the biggest challenge.
Yeah.
In terms of operations and deciding what to do next, I guess, if I didn't have this opportunity that came to me, real estate in Kelowna is not it's not cheap. Right? In BC it's not cheap, and
Yeah.
I honestly didn't have the operating capital to just like pick
Yeah.
up and start somewhere brand new, when you're paying with triple net in like $60 a square foot, right? It's just not
No.
it's not affordable.
No.
Um, and so that was the next challenge was like, okay, what do I do? Because I did hear through the grapevine there were maybe one or two clinics for sale,
Yeah.
and so do I take the plunge, or do I just start like doing some market research on some real estate? So I
Mhm.
did both of those. Um, the come to like taking over the clinic. The biggest challenge was like applying for these accounts as a new
Yeah.
vendor, like all of these insurers and ICBC and WorkSafe. You start the process well in advance because you know that you're probably going to have a delay.
Yes.
Well, maybe I won't name the insurer, but one that has three letters, and that one has that we've had some struggles with in the last couple of years. Applying for this account in the middle of August and not having them see my actual application until October, and then finally approving me at the end of October.
Oh my God.
So meanwhile, and I mean, direct billing is a privilege for our clients and patients, but
Mhm.
and it's relatively new within the last 10 to 14 years.
Yeah.
But we want to provide that service because not everyone these days has just like a
Yeah.
lump of cash that they can invest into their health.
Mhm.
And so that that wasn't the only insurer. There were several other
Yeah.
insurers that took a long time as well. I knew that was going to resolve eventually,
Yeah.
but that was definitely
Yeah.
a big challenge.
There's so much
Now, yeah,
administrative red tape. Yeah.
totally. But on the flip side, to answer the rest of the question, I think the easiest thing was, again, I'm grateful for, is that people started to actually come to me and express some interest to
Mm,
work with me and be part of the team.
yeah.
And so that was on the both administrative and the clinician side.
Mhm.
And in honesty, even in the last couple of weeks, there have been some people who've expressed interest, or friends and colleagues that I perhaps used to work with are, they wanted to come in for support, also to see the space.
Mhm.
My door's always open. I'm pretty transparent and accessible.
I love it.
So I'm like, yeah, come on in and just learn what
Yeah.
this is all about. Learn um, what the space is like. Um, I'm trying to think of other sort of easy things. I don't know. It was easy, I guess, to get people into the door, because once I left, people did start to to find me and seek me out.
Hmm.
The
Hmm.
challenge on that side was there wasn't a lot of visibility because
Right.
I had to abide by non-solicitation. And
Yeah.
so when I announced my resignation, like I couldn't tell anyone what I was doing or where I was going.
Yeah.
And so I think the biggest win right now is I have hardly spent a cent on marketing, and we've grown organically. Um, and not just myself, but all of our other clinicians as well.
Wow. That's
Yeah.
a huge accomplishment. Congrats, because, like that is a testament to, the care you're providing, the leadership you're providing. I think when people are seeking you out after leaving, or, clinicians seeking you out to work with you, I mean, I think that's a huge testament to just who you are as a person, obviously, because you are, people seek out the people they want to be around. So I think that's huge. That's like, yeah, I think that's a
That's
very nice compliment.
yeah, no, that's very kind. But this is also a small community,
Mhm.
and everyone tends to know what each other is doing. And it's you just the easy answer is just like be a good human,
Yeah.
don't do anything dumb, uh, apologize if you disrespect someone, and then you get a good reputation. Like
Right? Like,
easy,
it's
right?
pretty simple, it's true.
Yeah,
Well, and I mean, like, I obviously have had pre-sent you a few questions, but, like, that really, I think, encapsulates, like, what makes a good leader, right? It's like emotional intelligence, owning when you've perhaps made a mistake, and being kind and respectful. But, yeah, I mean, I'd love if you would, if you wanted to expand on what your leadership philosophy, or what your leadership, kind of, like,
yeah,
self-rules are. I'd love to hear a little bit more about that. But, I mean, I think at the end of the day,
yeah.
being a good person is really integral to being a good leader.
That's it. There's no secret. And I think if you come into it thinking that you're going to get all the accolades in the world and you're going to leave this huge legacy, then you're disillusioned, because that is not the case. If you come into it with an open mind, and like I said, if you grow with the people around you who are picking you up,
Mhm.
then that's really the way to approach it. Because you don't do this for accolades. Um, I think deep down, though, you do want to leave your mark to some degree.
Yeah.
And whether big or small, as long as you know emotionally and in your heart that, okay, I'm satisfied that took place. And so in the positions that I've been in, I think as I come out of this president's role in the spring,
Mhm.
um, I definitely know where I've made a difference.
Mhm.
Um, and I feel that the rest of maybe outside the board, the rest of the membership isn't necessarily going to know that,
Right.
but they're going to see the results. Um, and if you, if you feel good about leaving where like there's a direction and a plan going forward
Right.
that you had a little bit of a hand in, then that satisfies me as a leader.
Yeah. Well, and that's service too, right? Like, it's doing it because you feel so satisfied for the service that you've been able to contribute, versus like, I feel really good because I have this title and do these things, right? Like, it's a very
Yeah.
different motivation within all of that. And now I obviously really want to unpack your PABC role and talk about kind of the advocacy side of things. But before we do that, I kind of want to like hit home a little more on the clinic ownership piece. What were you, if you were to do it again, I would be curious, is there anything you would do differently?
N- no, actually, I think I think if I was ready, and in full transparency, I'd been offered partnership several times throughout the last 5 years, and I think if I was ready, both emotionally, financially, then I wouldn't be in this
Mm.
space right now, right?
Mm.
Perhaps better off financially, but then I again I wouldn't have this.
Yeah.
So I honestly, no, I wouldn't have done anything different.
Oh,
This worked out the way it was supposed
yeah.
um, to be honest. And again, to have walked into this space day one it felt like that I was always supposed to be here.
Mm,
So when it's when it feels like that, like, and that's what I want for my team. It's you want to come to work
yeah.
every day because you desire to be here, and that's definitely the vibe that I want to generate going forward.
Yeah.
So the short answer is no. I would not do anything differently.
Yeah.
Um, Maybe invest a little bit more so that I had kind of a bigger operating capital, but like that it worked out. Like I
Those are
said, everything
details.
worked out the way it did. Those are, yeah,
Those are
minute
details.
details.
Well, I love that though, because that really speaks to, like trusting the timing, trusting your intuition, like trusting that when it arrives or when the opportunity comes, like feeling into it. There is something to be said really about trusting yourself, trusting the timing. And like, if it doesn't feel right, it probably isn't, right? So you obviously had this opportunity, felt into it, and was like, yeah, yeah, this is it. Let's
Yep.
move forward with it.
And I think that's it. It felt right.
Yeah.
Um, and I kind of put emotional and investment into it
Mm,
too. I took the risk.
yeah.
And but knowing that once again, everything I do is rooted in love. I know it's going to succeed
Yeah.
if we put like all heart into it.
Yeah. Yeah.
Yeah.
I love that. Like, and having emotional investment, skin in the game, like it makes it so much more meaningful.
It does. But it also, if you sometimes if you live in that emotion, can also be not
Uh,
so good.
yes, I can attest to that. Yes, we have to have skin in the game and have, belief and want to and enjoy it and have emotion invest in it, but our self-worth cannot be tied to it.
Mhm,
That's what I've learned in the
mhm,
last 2 years.
mhm, mhm. Which is why too, like as part of one of my hats, I try to live in the mental health space and
Yeah.
be an advocate for that, because I've seen so many people in this community like struggle.
Yeah. Yeah, that's interesting. I'm curious because I know that this is a huge passion of yours, especially working in the advocacy space for mental health. What does that look like for you? Like, where do you, like, what areas are you advocating in? Like, what communities are you involved in? Because I know this is
Yeah,
a big
it's
passion.
not it's not huge. I there's a local brand here that I've become a kind of an ambassador for. The
Mm,
brand is called Friends of Felix, and so they sell merchandise, branded merchandise that basically helps to support men's mental health initiatives.
mhm.
Um, but for myself, going through an emotional journey over the last year, I've really leaned into, groups that support each other because it's, and coming off of Men's Mental Health Month, um, it's a lot of people just don't talk about it.
No.
And so I belong to this group also that is run by a friend of mine who we basically it's a run and huddle. So we run 3K, we get together, and then we just kind of have have conversations
Yeah,
afterwards.
that's
But
huge.
it's I definitely just put myself out there in support of. I'd like to be actively a little bit more involved when if I have the time, um, to to do events or to do anything that I can do to support it. I
Yeah.
will.
I love that. I love that. I mean, mental health in general is obviously so incredibly important. And working as healthcare practitioners, it's something we're all aware of. But, like I think men's mental health specifically, because there is a lot of stigma around conversation and vulnerability for men. I really commend you for that work. I think it's huge. And you're obviously demonstrating through, like you're living it, you're expressing your emotion, you're someone who is in tune with that. So I think that's really fantastic. So tell me a little bit more about some of these resources actually, because I think I mean, obviously we're deviated here, but I love this. I would love to hear some of the resources that you support and encourage other men to look into.
Yeah. So the main one is Friends of
Friends
Felix,
of Felix. I'll link that in the show notes.
which yeah, there are other groups that I'm not necessarily specifically involved with, but
Mhm.
support like Third Space Charity,
Mm,
the Foundry. So a lot of these. organizations will help to support like youth mental health as well, which in Kelowna, BC, I think very high population of youth are going through it,
Hmm.
and we don't want the future of our population to be statistics, right? So
Yeah.
I find that the more of these resources can come up and support, especially youth, obviously the better.
Yeah.
And um, so those three sort of are the big ones that, especially in Kelowna,
Yeah.
that are really advocating and supporting initiatives like that.
Yeah, absolutely. I'll link all 3 in there because I think, like, the more resources we can share, the better. I think
Mhm.
it's really big. What are some, unique considerations for I mean, you've obviously just opened a clinic in Kelowna. I find the Okanagan and Kelowna specifically are kind of their own it's like its own unique landscape in terms of business, just because you have a very high population of people who come for vacation, right? Like, it's a very touristy area. Like, what are some of the big, like, business considerations that might be unique to the Okanagan versus the rest of BC?
Yeah, I think, like I said, it's a small community,
Yeah.
so um, I don't necessarily think it's like saturated from a physio clinic perspective, but there's a lot of people in need. When I moved here, um, I realized that this is such an active population,
Mhm. Yeah.
right? From youth to 100, like they're still doing a lot of activities. I remember my first week in practice here. I treated an 80-something-year-old who was upset because she strained her back doing burpees in a high intensity in a hit class, right?
I
I'm like,
love
this
it.
is this is amazing. So I think one is, the population of people that you see, especially
Yeah.
coming from Saskatchewan, like you're seeing a lot of farmers, farming community.
Totally.
Um, but one of the challenges I think was at the time when I was at the other clinic was
Yeah.
recruitment of physios,
Yes.
and it would be nice, and I think this is kind of in the future going to happen, but it would be nice to have a cohort of the physio program here, right?
Yes.
And
I
I mean,
agree
yeah,
thoroughly at UBCO.
yeah,
Yes.
yeah. So we know that the government, and I think I can say this out loud, we know that the government has approved that. We just don't know when. It was originally slated for 2026. We just don't know if it's gonna if it's gonna happen.
Oh.
But hopefully, like we have had a big delay here with the building of the expansion of UBCO building,
Oh, okay.
and so I think I don't want to speak ahead, but I think that building was contingent on the expansion of the UBCO, or sorry, UBC cohort here,
Right, that
as
makes
well as
sense.
other schools like speech, OT, and then the expansion of the Southern Medical Program.
Right, yeah, because I mean, in Vancouver, we were all housed in the same building, like,
Yeah,
we all had the
yeah,
same location because I'm a UBC grad, so that would make
right.
perfect sense, but, like, it's funny, I just spent an evening at UBC Vancouver speaking, on the business panel, and they
Mhm.
have a location at Victoria, they have a Surrey location, they have a PG location. I was shocked they didn't have a Kelowna location, like, that to me makes the most sense. It's,
Yeah,
like, it is kinda wild. So that's exciting to hear that actually, I'm excited to hear that it
Y-
potentially is coming to
yeah.
Kelowna.
So yeah, let's hope it's sooner than later. But I
Yeah.
guess going back to the question, it is, a challenge of recruitment, because I
Yes.
feel that if you didn't have roots here as a student, then most would go elsewhere or stay in the lower mainland. And yeah, so that I
100%.
feel affected the landscape of recruitment. And you can entice all you want and offer signing bonuses and stuff like that outside of to those outside of BC, but in the end, especially with the housing market, it's crazy to live here.
Oh my gosh, right. And like
Crazy
recruitment,
expensive.
it's crazy expensive. Like, and I'm in Kamloops and it's expensive here, but it is not Kelowna, like, or Vancouver, obviously. But
Yeah.
yeah, and recruitment is such a problem across the board in BC. But then, yeah, you add in the cost of living, you add in like all these other economic factors, and it becomes really challenging. But yeah, I think you're right. If there was a school there, then there's a little bit more like of a root planting
Yeah.
happening in the
Yeah.
city, or maybe more relationships being built. Like people often will like meet their spouse while they're in school, and so perhaps they're already rooted, so
Hmm.
I think having I think it's great that they have a school in PG, because that is like, opening the north up so much more
Yes.
to like, which is obviously a place where they're desperate for physiotherapists. But yeah, opening it up in the Okanagan and the central interior, southern interior, I think that's really going to help with, perforating the province with more more physios.
Yeah. Yeah. Totally. And I think throughout the last 10 years, anyways, as I've been exposed to it, it fluctuates. Like there have been some years where there are more new grads that come back and
Hmm.
that are retained here than others.
Hmm.
But I think that definitely on the recruitment side has been a challenge.
Hmm.
Um, Trying to think of other sort of landscape things. I don't think much different than any other region of the province, like um, percentage splits and people negotiating contracts. I think that's all kind of the same.
Yeah.
I would say, in honesty, some clinics and owners are way more established than others, and so perhaps they have a little bit more operating capital
Yeah.
to offer something of of that perceived value for someone coming in that's new.
Yeah.
Um, yeah, I can't think of anything else right now.
Yeah. Yeah. No, fair enough. And like Kelowna is its own city, but it is a small community. Like it really, and I think it probably has some of the same issues that some of the bigger cities, like you guys have the issue of like the economics of running a clinic are incredibly
Yeah,
high, because you're a high, that's a big piece of it. But it is also dealing with like small town issues. So you kind of have like, maybe all the benefits of both of those things, but then also like the challenges that come with both being a big city and a small community. So yeah, it's a bit of a
yeah,
catch-22 on both sides, I would say. So probably a bit of
yeah,
everything.
yeah, totally.
Um,
We are definitely a small city that tries to be, or a small town, I should even say, dare I say, that tries to be big. And, you know, like there's so much sprawl, like building sprawl here that's coming up and being approved. I'm like,
it's
we have
crazy.
one main
The
road that's a
bottleneck.
highway.
There's
Yeah, there's
one
such a
bridge.
bottleneck and one bridge. I mean, even getting to my house, there's only two roadways to get to my house. So,
Oh, like
and
traffic is so bad
yeah,
there. It's
yeah,
brutal. Well,
it
hopefully
is
there's
brutal.
some funding coming for making that better, because that. I mean, I would consider living in Kelowna, but I like, part of the reason why I left Vancouver is traffic. So,
Hmm.
so
So
for
yeah,
yeah,
fingers crossed.
yeah, totally. So I'm curious. So then you obviously started with PABC as the Okanagan board representative.
Yeah,
Let's talk a bit about your journey from, yeah, like for the volunteering, like with your role with PABC and being on the board of directors. Like what was kind of, I mean, obviously you're someone who's done a lot of time volunteering and gets lots out of being in service. I'm curious, yeah, like
yeah,
what did that look like? Why join the board? What were the motivations there? And yeah, what's your journey been through there?
yeah. Um, I guess, I guess theoretically, I'm still the Okanagan director. So we'll definitely be looking for a new Okanagan director in the spring. But I filled a filled a position. I was shoulder tapped by, because one of the owners of the clinic that I was at was the outgoing
Mm,
regional representative.
mhm.
So I felt that I wanted to, again, new to the community, let's figure it out. What better way to figure it out than to just like thrust myself back into volunteerism? Um, and so that's kind of how it came to be, I think 2017, 2018.
Right.
So like I said, it's been nice to kind of get to know the community, get to know the regions, the needs of the regions, um, and just like develop some friendships along the way.
Yeah.
Um, but then also, coming from a national division to a provincial branch is like very different,
Yeah, I believe
right?
it.
And
Yeah.
so we're now dealing with government relations and advocacy and membership support and advancement of the profession
Right.
versus kind of advancement of just kind of one small aspect of physical therapy practice,
Right.
right?
Totally. Yeah.
And so I found that to be eye-opening, and throughout the last few years, just how much of an impact the association has, especially in pushing profession forwards.
Yeah.
And in that time, like trying to get diagnostic imaging, trying to revamp our scope of practice, and you know, just learning a little bit more about our influence on regulation and
Yeah.
how it's like it's huge, right? The timing, how you present it, who you present it to,
Yeah.
what government is in power at the time, and how that potentially will influence your pitch. It's all definitely eye-opening, but a great learning experience, both regionally and like provincially.
Yeah.
And then I'm actually leaving for Ottawa next week for our CPA component summit. So that's where all of the provincial branches will come together, info exchange, and
Yeah.
at that point you get to learn about how every jurisdiction is different. And then you wonder, like, why is every jurisdiction different?
Mm.
Right? Shouldn't
Yeah.
shouldn't the profession be operating the same everywhere?
Yeah.
You'd like to think that, but you know, we don't have diagnostic imaging, whereas Nova Scotia, PEI,
Yeah.
Ontario, they're making great strides in that realm.
Yeah.
Alberta,
Yeah.
you know, and I feel like, why are we behind, or why are we not there yet?
Totally, totally.
Yeah.
Yeah, and I mean, I know that that's one of the biggest issues right now too is scope of practice. What are some of the other biggest issues that you see in the province right now? I mean, I know we spoke earlier and Andrea Burton has covered lots of them, but yeah, I'm curious because your lens is obviously of that as a practitioner as well. So you feel it on a daily basis in your practice. Yeah, what do you think are some of the biggest issues that our profession is facing in the province primarily, but maybe even in the country too?
Yeah, I think the biggest one is the HPOA, the Health Professions and
Yeah,
Occupations Act.
yeah.
And like I mentioned earlier off camera, I'm running into clinicians who didn't even know that our college is amalgamated over a year ago,
Right.
and that our College of Health and Care Professionals in BC now represent, 9 professions, right? Soon to be 10.
Yeah.
And what does that mean? What does deciphering a 300-page document mean for me as a clinician? And if you don't know, then I would suggest to lean into
Yeah.
being a member
Yes.
of PABC, because we're currently continuing to put out information through newsletter and blogging and all of that stuff. So that, I think that's definitely a big one. Um, uh, I find that also our general membership uh, doesn't understand the difference between what the college does versus
Yes.
the association. So understanding the differences, because they're very, very different.
Yeah, yeah. Break it
Right.
down. Give
Yeah.
us the
Well,
give us the
I
breakdown.
mean, yeah, in a nutshell, PABC, or your provincial association, is, it advocates the profession, the individual physio, right? And we try to push the profession, um, and advance the interest of the professions,
Yeah.
of the profession itself. And that is, again, obviously dealing with government, insurance, versus the college. They're under the authority of the Health Professions Act, right?
Yes.
Even though it says college in its name, it's not like college, like an educational
Hmm.
institution,
Hmm.
but they help to regulate the professionals. So they make sure that we have our criteria for licensing, that we uphold our code of ethics,
Yes.
right? Our standards of practice, and their function is to protect the public. So
Yes.
that is the difference, compare contrast in a
Yeah.
nutshell.
And like, quite honestly, when I graduated from school, I didn't know what the different one difference was. I paid my dues. I was like, cool,
Yeah.
great. And never really like I went from like not really understanding it to being like, oh my God, everyone needs to be a member. This is like, I've had a
Yeah.
real full circle moment with it in understanding it. But yeah, it's important. And like the work PABC is doing, like, and obviously I really have only been actively involved with it in the last 2-3 years. So I can't really speak to the work that was being done prior to that. But I have to say, like, I am blown away at the work that you and the team over there are doing. Like, things are changing. The landscape is changing. So I'm curious about what you're optimistic about, because there has been some huge strides and gains and movement on some of these initiatives. So I'm curious, yeah, what are you optimistic about for the profession?
Yeah, I think I mean, even to speak to some things that we're working behind the scenes now, like obviously with insurers like WorkSafe and ICBC, we want our clinicians to be paid their worth, right? So negotiating um, contracts in that respect. I think the big one right now is creating a position statement for regulators in the government to understand that as physiotherapists, we should be able to order diagnostic imaging,
Yeah.
right?
Yeah.
So I think that's a big piece that we're working on right now, and there are awesome people at work and within our staff, as well as ad hoc committees that have put in a lot of time
Mhm.
and their ideas forward, because other provinces have seen success with
Mhm.
it. Um, the other piece is like continuing to develop like partnerships, both locally, nationally, um, aligning better with like CPA, the National Association.
Yeah.
Um, I mean, CPA had just negotiated their sort of service agreements with every province. So figuring out what that looks like, and for the association being able to now understand who our members are, and all of the kind of operational things that are associated with that.
Yeah.
But I think, again, in a nutshell, going forward, the biggest pieces are diagnostic imaging,
Yeah.
physios in primary care
Yeah.
centers, emergency departments,
Yes.
um, paying our public practice physios more,
Mhm. Mhm.
right?
Yes, please.
All of that stuff is stuff that we've been working on, and then there's just it's been nice over the last year to put out position statements on pelvic health
Yes.
and dry needling,
Yes.
um, that are really um, will help, particularly with the scope of practice piece.
Yes, absolutely. Yeah, it's been an interesting like year for me in that perspective too. Like, I've started working for the first time in my life in the public system, and I work at the urgent care center here in town. So I would say in the public system, I'm working as like top of scope as possible in the public system for a physiotherapist. The one thing that drives me absolutely bananas is that interior health does not allow us to needle, even though we are allowed to as a profession. It is very
Mhm.
silly. But other than that, it is such an interesting experience, because, yeah, the way it works is the people come in, they get triaged by the nurse, and then if it's something musculoskeletal, they get booked into my schedule. They don't go to the doctor or to the nurse practitioner. They come to me, and it drives me so bonkers, because if I think someone needs an X-ray, they still have to go back to the doctor anyway, right?
Yeah.
And so, but I have to say, like, having this role, it's a brand new role, it's a new facility. It is so neat to be able to work similarly to how I would in private practice, which is where I feel physios are working top of scope, but doing it in the public system and being able to provide a service for people who do not have extended health benefits or who cannot afford it otherwise. Um, and then, I think putting there's no reason why a physiotherapist can't also be doing this in emergency. Like I find in the public health system, we like quite honestly, like I feel like physios are completely underutilized in the public health system. Like I don't think it requires the level of training that we have to be, obviously like mobility is important and doing these things are important in the acute ward or in the, post-surgical ward. But I really feel like physios can be working higher level, top of scope. So I think a huge initiative is educating the authorities and government on that primary care role that physios really truly are. I've become very passionate about it. I tend to get very passionate about the things that I'm doing, obviously. But yeah, and then also paying physios well to do that. Like I'm spending people doing assessments probably more thoroughly than a doctor would in this scenario, yet I am not pulling in the same amount of money a doctor or nurse practitioner is. That's for darn sure.
Yeah. Yeah.
Anyway,
Yes.
that's my rant on it.
Okay. Totally allowed. Yeah, it's yeah, I think that those are just the small examples that the association does,
Yeah.
which I think the general membership and our profession doesn't know or think that we do. But
Yeah.
just know that we're like, there are people that are, and even just we're all volunteers, right? That are putting this effort
Yeah.
to make changes, and also getting ideas from other provinces and what they've done well,
Yeah.
um, and putting that forward as well.
Totally. And using their movement towards things like diagnostic imaging as leverage for, our negotiations as well, which is really good. So yeah,
Yeah.
keeping tabs on what's happening everywhere else is huge.
Yes.
I'm curious, like so many people obviously don't even understand what PABC is doing, as we've established. But, for people who are kind of starting to hear like, HPOA, rumblings of imaging, like people are kind of starting to like wake up to the fact that these things are happening. How can people in the profession start to participate a little bit more without like having to become a board member or, like what can people do just to kind of start supporting these initiatives?
Yeah, at an association level, over the last year and a half, we've restructured kind of the subcommittee realm. And so we're basically, if there needs to be some input and work to be done, we're putting out call outs now.
Mm, mhm.
And the response to call outs has been quite enormous because, yeah, like that's an issue that that person is passionate about. So they might have a chance to shoulder tap one or two of their other colleagues who might have an interest. And so that's the way, at least right now, by the mechanism to be involved without having to just like try to run for a board member
Yeah.
position.
Yeah.
And like I said, it's been quite a good response. However, you wouldn't necessarily know that if you weren't a member either. So,
So be a
um,
member, pay your dues.
so be a member, pay your dues. It's worth it. There's more value than, again, just like from a national level anyways, your sports check discount and
Yeah.
insurance discount. Like you get to be involved with these pieces. And again, I think back on the scope of practice piece and now this diagnostic imaging piece, that the same people who I see on kind of the list of volunteers have been in the game
Yeah.
with these things over the last 10 plus years,
Yeah.
because they're passionate about it, and they're not necessarily board members. They're just like, they want to
They're
put their
involved.
input in because they're totally involved. They want to
Yeah.
get involved.
I love that. I love it. And
Yeah.
I love this way of doing these call outs because it feels so much less formal. I found, in the past there was always committees, right? And like the word committee, I
Yeah.
think just is like a barrier for people because they're like, oh, now I have this thing where I have to go to meetings once a week or once a month or like, and it just sounds so formal and I
Hmm.
have to take minutes and it's just like, oh, my life is busy.
Yeah.
But a call out to kind of have a discussion group or, even just the way we're using the app now. Like we have the PABC app, the BC Physio app that Sean created. And now there's like just different subgroups in there where people are just chatting about it, right? Like it's so much
Yeah.
less formal. I can do it while I'm literally sitting in the waiting room while I wait for my physio appointment. I can, put my 2 cents in or read what Brian Waltz has said in there. And, like, and he's a great example of someone who's very
Yeah.
involved and very passionate of it. And I
Yes.
absolutely love
Yes.
communicating with him. It's great. But yeah, like these call outs are so great because it's like, sometimes there's topics that comes out that I'm like, oh, I know nothing. And that doesn't really, like I don't practice in pelvic health. So that's not really, but I will happily join a call out for something around, direct billing or whatever that looks like, because I am deeply passionate about that. So it allows for a little bit more diversity, I find. And
Totally.
and it just feels less formal. Like I can just
Yeah.
chat and email and, jump on a call here and there. And I actually really like that and
Yeah.
feel it's less of a barrier for people. So
And that's it, is to make it more accessible and not formal and onerous. And I mean, Andrea, our CEO, like she's very open with just calling or texting her,
yeah.
right? She's given everyone her number, and that's the thing is, when we created our strategic plan and when I came on as president, I really wanted to ensure that the communication piece was there and that we were communicating out to our members real time.
Mm-hmm.
Nothing kind of shrouded in secrecy and just only putting tidbits of information out there that people needed to know. We want to be able to like provide all the information
Mm-hmm.
as much as we legally can, right? To everyone that asks a question.
Yeah.
Because they deserve, again, they're paying money to be members. So that is also a value, to be transparent in the work that we're doing and all the information that should be accessible
I
to the
love it.
membership.
And like the
Yeah.
dissemination of information has been so amazing. Obviously, we have this app, but I mean, Andrea's blogging weekly, sending these updates. Like, there's just so much more information coming out that it feels less like previously I was like, I have no idea what they're even working on. I have to dig for this information to, and I'm the one who had to like
Yeah.
kind of reach for it. Now it's just like I get emails all the time and I'm like, I love it. Great, cool. Fireside chat. Yeah, sign me. Like it's so
Yeah.
much more push versus pull. And I absolutely love it. I think there's been a real turn and I hope it is reflected. I really hope people sign up. I really hope it is reflected in the numbers and in the membership. So
But again, people like yourself, people like Brian, and so many others that are doing these things like this. I feel that part of this is a product of what we've done
mhm,
to try and engage the membership.
100%.
Um, and so that's definitely the space that, especially as I exit, kind of we want to continue to grow and evolve. And one of the other thing is like professional development.
Yeah.
And I feel sadly gone are the days of like attending in-person courses and things like that, because
Yeah.
people want to just have accessibility of education and
Mhm.
obtain their certificate just with stuff online that's accessible through devices and things like that.
Yeah.
Um, so yeah, that accessibility, using technology, using AI, redeveloping our website so that information is accessible whenever you need it. Definitely has been in my now, I don't even know, since 2017 to now, right? Like
Yeah.
has definitely evolved at an association level.
Yeah, and I mean, like, I see it happening and I feel it, and I'm far more involved than I've ever been, obviously. Yeah, I'm like, your time is coming to a close. It's the spring when your term is up. I'm curious, like, I mean, obviously, these are some of the big, amazing milestones that you've had. Is there any other, like, big things that you're really proud of during your time? Or, like, what are you excited to leave as a legacy for the next person stepping into the board? I know we've talked a little bit about legacy, but
Yeah, I
I know
think
it's not kudos, so
no, no, I feel that because I still have to serve as a past president um, role ex
Right,
officio for a year,
right.
and that's something that I actually we created because we changed the constitution some time ago to change terms, and so it's my own doing that I'm here longer than I expected to be. Um, but no, I think going forward, I feel, especially because there was a transition of board members in the spring as well. So
Mhm.
the association is in good hands. We're coming up to a new strategic plan period as
Hmm.
well. So just now using what we know and learning from previous work that was done going forward, I'm happy to know that the work, like, there shouldn't be any glitches with the process,
Hmm.
because I feel that over time, it's the process that we've had to kind of relearn. And with the transition of CEOs as well, kind of moving from one process to the next, both operationally, financially, like fiscally,
Hmm.
and just even from a board governance perspective. So um, there are systems in place now where the institutional knowledge should be transitioned, so that if in case there is a sudden transition of whether it's CEO or a board member,
Hmm.
there should be a place, or there should be a seamless transition, and
Yes.
then you can refer to something to get the information, or you can have sort of a short-term mentor with another regional representative to give you the information.
Totally. So you're not stepping into it without
So
any knowledge or supporter. Yeah.
yeah, totally. So I think knowing, as I kind of step out of the position there, like, Sarah is going to be great. She's the incoming president.
Mm,
And through the year, we've always communicated, and she's
yeah.
been on some of those kind of leadership meetings, executive meetings, so that she's well informed,
Yeah.
versus like catching up on information that, okay, here's what you need to know.
Yeah.
Um,
That's huge. That's a
so
really cool
yeah,
legacy. And that's so transferable to clinic ownership too, right? Like creating
yeah.
those systems, those operation manuals, those references, like having that in place is huge and like makes life so much easier for everyone around us, right? When we have those systems in place. So I think that's like you've obviously really strengthened the structure within which the board operates and PABC operates. So I think that's a pretty darn cool legacy if I
Well, I mean, it's definitely, the work of the board that's done that to, and I don't want to say clean house, but really just kind of have this huge meta, like, overview of what's deficient, what are we doing well, and then being able to, I guess, clean that up,
Yeah.
and having Andrea and the staff kind of now operationalize some of those suggestions, so that the board can actually do the work,
Yeah.
like do board things,
Yeah.
right?
I love it. Yeah, you've
Not be
refined
bored, but do
it.
board things.
Yeah,
Yeah.
totally. Yeah, so you've obviously refined it. Like I think that's really amazing. Um, Vince, I'm thrilled. This is such a fun conversation. I've learned a lot. And before I ask you the very last question, are there any other like words of advice or like last little bits you want to add in before I ask you the last question everyone gets?
Right. Um, I guess, and we, again, talking off camera, like, I wear many hats, and I
Mhm.
think it's important for, whether you're a clinic owner or clinician or whomever or whatever career path you've chosen in this profession, to do something totally different,
Yeah.
right? Like, have other hobbies, and so that you can take a brain break from
Yeah.
from the clinic day,
Yes.
and that's why I'm an actor. I do acting for TV and
Yes.
film on the side, and that's been definitely a journey over the last 5 years. Um, but also at the same time, like, not wear too many hats,
Yeah.
because I have reached a period where I think I've probably had some burnout, and
Yeah.
so over the last year, now into clinic ownership, being able to hang a hat or sort of unload some of the things that I was involved in before, including,
Yeah.
transitioning out of PABC,
Yeah.
um, has been nice,
Yeah, and
much needed.
we were talking about it earlier, like, burnout is really common in our profession, and, like, we've spoken a bit about the mental health piece, but burnout is a really big problem. And I think, as much as like, well, we all love our profession, clearly, the reason we're even having this conversation is because you and I obviously both are very passionate about the profession. Um, but it is really easy to get like burnt out. The work is not easy. We treat some, there's heavy days, right? Like we work with clients who've been through a lot. And I agree. Like, I think having a life outside of the profession is super important. And whether that is like another career or different hobbies or just taking time away from it, whether that be to travel or to, whatever that is, I think is absolutely right. Like, I think that's huge. And like, you obviously have a lot on your plate. How do you balance it?
Yeah, I used to say, well, it's just got to be done. Like I'm involved in it, and so it's just got to be done. That's not sustainable. But thankfully, I have a supportive family, like my wife and children, and um, supportive clientele base as well.
Yeah.
Because if I do happen to book something that I need to be away from the office for, then they're pretty understanding if I can
Yeah.
reschedule them ahead of time.
Yeah.
Yeah, that balance piece is something that I strive for all the time, and I think we each have our own way of trying to seek refuge in doing other things.
Yeah. Yeah. Totally. Well, and so it sounds like you're not going to have a sudden huge vacuum of time in the spring because you are committed for another year beyond that. But once that's done, what are you going to do? Like, what are you going to find another way to volunteer? Or are you just going to like allow the other areas that you're involved in to naturally
Yeah,
fill the space?
yes. So the latter, definitely going to work on and be involved in what I'm already involved
Yeah.
in, being an owner, teaching, um, acting,
Yeah.
and yeah, so that's the hope. If the expansion comes to fruition here, I'd love to. I mean, I'm already a clinical instructor in the Faculty of Medicine,
Mhm.
so that's kind of a foot in the door already for hopefully the MPT cohort.
Yeah.
Um, maybe like drop back on clinic hours a little bit. Who knows? And then just continue to like book more movies and
Yeah.
stuff. Yeah, I'm gonna pause definitely on the committee work, the
Yeah.
volunteerism for now. Do stuff that continues to get me paid. But that was the biggest thing when I transitioned as president. My wife was like, "Hmm,
Yeah.
is that going to get you paid?" I'm like, yes, it's going to make me rich in my
In
network,
here.
honey.
Yes.
Uh, um, yeah, just hone in on the stuff that I'm already doing as I
Oh, good
unload.
for
Yeah, for
you.
sure.
And like
Yeah.
there is really something that builds, that like inner wealth from volunteering and from doing that. And there's also nothing wrong with wanting to get paid for the hard work that you're doing. So I am with you too. I'm doing
Right.
a lot of volunteering right now too, and I get it. So, but it is rewarding in its own way. So yeah, I fully understand that. And I'm also very intrigued about potentially like if this school does come to Kelowna. The wheels are
Hmm.
turning in my head, so we will have
Hmm.
that conversation when it becomes official.
For sure. We should do it. We'll do a part two.
Yes, exactly, and then maybe we can both teach our own courses at the school and
Oh.
influence the next generation. There we go.
Hmm. Hmm.
So the last question I always ask everyone, given the name of the show is The Health of Business, what is a healthy business to you?
That's a good question. I think a healthy business, and I alluded to this early, is for your team to wake up and want to be there with you every day. And I know that because I've watched other of your podcasts,
Yeah,
you speak of culture, and
yeah,
I think that's definitely important. But for me, a healthy business is, like I said, multiple times, it's rooted in love, and if that love is still there, then you've done well.
yeah.
Um, yeah, I don't think it's any more than that. Honestly, I think if everything is obviously you're still smiling at the end of the day when you arrive and you leave. then it's good.
Yeah.
It's good.
I love that. I mean, sometimes it's just literally as simple as that.
Honestly, if I have nothing else profound other than to say that.
Happiness and love. People want to come to work and feel supported, happy, and loved at the end of the day.
That's it. And like I said before, and my piece of advice, and I want to break the fourth wall here for a sec. Like, hello, physio, clinician, friend. Stand up tall, value yourself because you've had a kick-ass education.
Yes.
Do good things. Be a good human. Don't do anything dumb, and apologize if you've disrespected someone.
Vince Cunanan. That was amazing. Mic drop.
That's it.
Boom. That's it. That's the show. Thank you so much for your time today. I am thrilled to get this out of here. Thank you. Like, I can't wait for people to hear this. It'll be a few weeks, but I cannot wait for people to hear this.
Totally fine. And like I said, I'm grateful to have this experience and opportunity with you. And I wish you the success, continued success with this. It's awesome. You're doing great.
Thank you. Likewise. Enjoy your newfound semi-freedom in the spring.
Whatever that looks like. We'll see. Ask me again, Ben, just to make sure that you hold me accountable to like not being involved in anything else.
Absolutely. No committees for Vince until at least a year from now. Amazing.
Please.
Well, thank you again. And we'll do it again soon.
Okay. Thanks, Danielle.
That's it for this episode of The Health of Business. If you're navigating any of these challenges in your own clinic, know that you're not alone. If you're interested in working together on any of these challenges in your business, head to danielleboyd.ca to learn more about my consulting offerings and to get in touch. Catch you next time on The Health of Business.